The medical field is really predicated on utilizing technology to help our patients. And of course, my goal, and I'm sure all of my colleagues' goal, is to be the very best doctor that we can be. And leveraging technology like Carrot is going to help us do that. Very early on, my mentality was, what can I do to make sure that I'm providing and I'm in control of making sure my patients have the best customer experience, the best level of care. Over the years of practice, I've had a couple different models and styles of tabletop perimeter. Ultimately, what began to happen is they were just aging. It was becoming a cost for our clinic, and the cost was, number one, all of the repairs that we were having to do on the device, but also number two, the downtime, right? So if the device is down, we can't run those tests. We decided we needed to make an adjustment, and we pivoted into our Carrot unit, which we've really loved.
Since using Carrot, my day-to-day workflow has become much more smoother.
I found it very intuitive to use, quick and easy to set up.
I don't have to walk patients through a complicated setup now.
A lot of the patients who have to do perimetry testing, they tend to be a little bit more advanced in years, and that becomes challenging when you're having to put them in and out of this kind of big device.
They're just bulky and they were never comfortable, like you could never get the right height, you put your chin in your head, and it was just a little awkward.
Now, the whole setup probably takes 30 seconds, and then the test itself probably only takes about 2 minutes to 2.5 minutes.
I would say the headset is much more comfortable. You don't even notice it.
While the patient is taking that test, I'll put in the results from our other tests that we'd already performed. It allows me more time with the patient to be able to sit, have a more relaxed interview and interaction with them. And it speeds along the pre-test also and allows us to pass those patients off more efficiently to the doctor.
With the old perimeter, whenever I wanted to print a report, to go and look at the data, I had to get up, walk down the hallway, get my hands on the device, pull it all up. One of the features I've really enjoyed with our Carrot is that I can be in my back office and I can just pull up the portal, log in right from my desk in my comfy chair, and I just log in and I can see all of the data that I need to see.
One time I had a patient come in who did not speak a lick of English. He spoke Mandarin.
We're trained as doctors to try to figure out how to communicate things easily, even when there is a language barrier.
The headset, I looked through going, will it have it? Lo and behold, Mandarin Chinese.
It definitely makes things nicer that, at least in the pre-test room, they can hear that in their own language. When we're using this bleeding edge technology in our office, the patients are excited about it, that it really sets you apart.
I would recommend to friends or family members that would be the only way to go. Like, why even do it the old way? Those days are gone.
You can use the technology that's coming out to really serve your patients well, help them feel comfortable, help them understand the tests that you're performing, and happy patient, happy doctor.